my name is Helen Davies. I'm the Education and Training Lead Pharmacist at Cwmtaf University Health Board. Well, my actual full job title is Education, Training and Workforce Development Lead. And I've got a problem, and you'd be forgiven if you thought that problem was the fact that my job title doesn't roll off the tongue, because we know that. But within my job title is the word workforce, and my problem is the fact that our day one qualified pharmacists are not able to work in GP practices unsupervised. I mean, as that's my bread and butter, I need to solve that. And that's what my Bevan Exemplar project was about. So let me take you through my project. Let me just give you a bit of context. When I talk about primary care pharmacists, I mean in GP practices. So most people will know of pharmacists working out in the community, in community pharmacies or in the hospital sector. And there are other roles as well, such as academia and research and industry. But really, within the primary care sector, we've had the prescribing advisor roles, which have been non-patient facing for many years, but not really any of the clinical roles until 2015. That was when the government funded the clinical, the cluster roles, really, which are clinical patient facing roles within a GP practice. And this was part of a sustainable plan to help release GP time. So that's gone well, but what we found is there's no actual formal training pathway in place for these people. So whilst it's gone well, there's also been a lot of training needed to upskill people within the roles. So really, we all recognise, myself, health boards and Health Education Improvement Wales, that we need to grow our own pharmacists able to work within the GP practice sector too. Because if we are moving towards, delivering a healthier Wales, essentially we need to make sure we're upskilling the workforce in that area. And in 2016, Cwmtaf embraced a multi-sector pre-reg programme. For those not familiar with the pharmacy training pathway, you do a 4-year undergrad master's degree, and then you have a year competency training year out in practice called your pre-reg year, and you pass the assessment at the end and then you qualify. They're soon to be known as trainee pharmacists as well, not pre-reg. There's a lot of changes going on. So there are lots of key enablers to developing quality primary care training, I'm pleased to say. Numerous documents with a lot of gravitas behind them. So we've got the Pharmacy Vision, which is helping to deliver a healthier Wales. The General Pharmaceutical Council have done some documents and some IETP changes, and the Royal Pharmaceutical Society behind it as well. Let's not forget that now GPs, since the cluster roles, GP pharmacists are recognised as a sustainable model, as are the technicians. And Health Education Improvement Wales as well have been doing a lot of planning, and as a result have secured a lot of investment from Welsh Government. And the end product is we're going to grow our own workforce and enrich multi-sector training. But for any training programme, competence and supervision is key. And basically, for me, the primary care setting is a high-risk environment. People work autonomously. They have to make difficult decisions with complex patients with lots of multimorbidities and a longer term. So the training needs to be right. So the situation when I first came into post in 2019 at Cwmtaf, I really tried to explore the voice of the trainers, and on doing that, essentially what I found was the training we were offering was very, very interesting, mainly consisting of shadowing because of the higher risk nature of the role. But if we look at things like Miller's Triangle, shadowing we know is a great way of training, but it's only really putting us on the nose or the knows how aspect of the triangle. And we really need to get our trainees up to the shows how one does, because ultimately by just shadowing is not preparing them to work unsupervised when qualified. So I was going to explore this as part of the Bevan. And my original solution for this problem was to create an app which would link remote trainees to role play scenarios. And the reason why this is useful is because one of the problems working out in primary care is I have to separate our trainees because GP practices are not really designed to host lots of trainees, so there's not a lot of room for them, so I tend to have to split them up. But for me, these topics would be around patient-centred primary care pharmacy consultations, around medication reviews. And of course, what I've done is I've included priority topics for the students to pass their exams, because then that's the carrot, to dangle to get them on board to use this app as well. The app will have a recording function so that when they role play these scenarios, the tutor can then review it to give some feedback and see how they're progressing. The cases will incorporate important themes to work in primary care, such as motivational interviewing, behaviour change, shared decision making, consultation skills, all the things we need our pharmacists to be able to do to be able to give patients the best care within the primary care setting. If this works as a platform, there's future potential. It doesn't just have to link pharmacists, there could be doctors or nurses on the other end of that. There's a real chance here for interprofessional education and multidisciplinary training, which I always favour. It could be as a platform for bite-sized learning as recommended in the Topple review. And future potential for AI, where basically it doesn't have to be role play. You could have an avatar at the end of that responding to your questions as well. So there's lots of future potential. And really, when I first came into this, the idea was I'd do it via virtual reality as well. So that, again, is another idea I'll be taking forward if this works. So following the health hack in 2019, I collaborated with my industry partners, Alpha Tango Delta. So the app was hopefully going to be created after receiving funding early 2020. And then that little thing called COVID-19 happened, and where I was hoping to get funding, that didn't happen. So actually the app is now in production. You'll be pleased to hear, but it's delayed. I'm hoping it's going to be ready by the end of April, early May, ready for testing. So all I can show you at the moment is an idea of how it's going to look. So we'll have our trainees logging onto their laptops. They'll go onto the app. They'll be able to see each other to role play. It'll be recorded, but basically the script on each of the screens will differ depending on the role you're playing. And I've been able to progress this app production because of a funding I received from the Pharmacy Delivering a Healthier World Project Board. Some of the app features mean, as I haven't got it here to actually demonstrate, there's going to be a unique identifier login screen, and that's for data protection. There'll be a progress screen to identify cases completed and highlight who's available to role play with you. So for those of you with teenage kids who live on the Xbox, you'll be familiar with this because they sometimes go on and see who's available. When you're doing anything and you're trying to get people on board, make it easy, make it default. And I learned that from the really good behaviour change workshop we did with the Bevan. So I've got a calendar plug-in to schedule meetings and remind people, make it easy. And then, as I alluded to earlier, there's going to be different screen prompts to really direct the narrative depending on who you're playing in that role play. At the end, there'll be an assessment screen so that the person playing the pharmacist can really take ownership of the decisions they're going to make on the medication changes. And there'll be a reflection box as well for how they felt the consultation went. And the role play, I think the trainees can have a bit of fun with this as well, because on the patient screen, for example, it'll come up to say, be angry, you were expecting to see a doctor, and then it'll be useful to see how the actual trainees respond to that. And overall, it's going to be recorded for feedback. So I did use the East Behavioural Change Framework when I considered some of the features. So I'm not expecting any of you to be able to read this, but it's just put up as a demonstration. So the app is only now in production. So I realised in 2020, in the midst of a pandemic, whilst I haven't got the app to help me with training, I need other ways to improve the training now. And we had a really good opportunity costing workshop with Bevan, and it helped me really map out the training pathway that I was using and come up with some solutions. And based on that really exploratory exercise, I was able to do a fishbone diagram to really highlight which are the main problems, really why my day one pharmacists are not able to work unsupervised in primary care. And I've circled the ones that I felt I can do something about, and that's things like not enough computers, being separated in practice, part-time staff, and basically trainees shadowing, they need more hands-on experience. So what else have I done in the interim then? I've reorganised the training pathway to complement staff availability, something really basic, but sometimes you need to process map the whole thing to make you realise these things. And I've also purchased trainee laptops. So for a cost of £600 per trainee, actually I've saved money, because if you look at the opportunity costing where I haven't lost trainee sessions, that's been really beneficial. So they can go and take their laptop into the practice. Lack of computers is no longer a restricting factor. And then, of course, Health Education Improvement Wales as well are also working behind the scenes. They're engaging with GP practices to enable us to access their employed staff for training as well, which boosts resilience. And they're also in negotiations with providing training grants to support and motivate this as well. And they've also employed some regional leads, which will really help in supporting the training. And overall, the hope together is that we're going to produce some quality training for our foundation level pharmacists. Positives of my Bevan journey, some reflections. The strategic support I received has been fantastic, as well as the personal learning and development and networking, because pharmacy, we all know each other, but it's great to have opinions from people from other backgrounds. It's been really useful. Challenges of being funded in COVID, and everyone else would have had that as well, I guess, but also progressing innovation. So things like the health hack are great, but really the health board protocols are not really designed for that. So if it wasn't for some really helpful people in the procurement department in CumTAF and the innovation leads, I probably would have struggled. So I'm really grateful for their support. Next steps, test the app and then work with my stakeholder partners to develop training. And essentially lots of thanks really for where I am at the moment, and that's innovation, procurement, finance, ICT, my managers, my colleagues, and HAW and the Pharmacy Delivering a Healthy Wales Project Board. They've all been really supportive, and of course everyone in Bevan and all the learning I've had as well.